Today I'm just going to give an overview of where we're heading in the future of eye care, but to start with, it's nice to place it in perspective. Of all those people who have vision impairment and blind, 3% of them are children. And the significant part about this is they have a lifetime in vision impairment ahead of them. So when you look at the challenges that the society face, that it's the number of blind person years really is equivalent to the challenges that occur with cataract, and cataract's the most common cause of vision impairment in the world. So there's significant health system, financial and lifestyle impacts from vision impairment in young people. The vision impairment is challenging in children because it can come from both the condition itself but also from the interruption of the normal development, because we've got a system that's developing rapidly through the first 10 years of life. Or it may be a combination of those things. One of the important things is how to identify these conditions early so that early interventions can occur and we can sort of try and prevent vision loss. Some data that the Safe Sight Institute was looking at is how to look at the overall impact on vision impairment in Australia. So what I've put up on the screen here is a graph of the top 10 causes of illness in children, and of those top 10, 3 of them are vision impairment. Now they're relatively straightforward in that they're refractive error, and that's sort of short-sightedness, long-sighted and astigmatism. And for those on the line, on the graph, there's a line which shows the top 10. So the top condition that affects children is hay fever, the second one's asthma, and then you get down to chronic sinusitis, behavioural problems. But then just below that line, there's sort of some really important sort of eye-related conditions. So strabismus or a lazy eye, they account for 1.2% of children, whereas the top one is about 10%. So you can see that it's quite a significant problem. Then cataract and glaucoma account for about 0.15 or almost 0.2%, which is a significant number. You add that to the retinal dystrophies, there's about another 0.2 there. But what's interesting is that those two are actually larger than cerebral palsy, and we've all heard about cerebral palsy and the impacts of that. So that's which is being obviously a devastating condition, but we don't often hear the same perspective about the eye conditions. The other thing I've put up at the bottom there is that childhood cancer, a terrible thing, is about 5 times less common than any of these eye conditions. So we have the eye disorders, which we still are trying to get treatments for, have a lifetime impact, and that's the perspective that I'd like to sort of share with you on where the eye problems, and that's probably why the Safe Sight Institute is quite passionate about children and their vision, because we really think there's an opportunity to try and change that. So the other concept that's becoming in healthcare is this concept of rare diseases, and it's always a challenge of how you're going to fund and make decisions about which conditions get funded. And so the rare diseases has been taking off now as a sort of worldwide concept in health, and it's defined as a condition that affects less than 1 in 2,000 people. And that puts a lot of the conditions that we deal with in children's eye conditions into that group. There's about 8,000 rare disorders overall, but when you add them all together, that affects 6 to 10% of the population. So almost 1 in 10 people will have a rare disorder. And if you take that into Australia, there's about 2 million people in our country who have a rare disorder. And so that does say that there's a significant challenge in our health system to try and manage those people. So I'll put up a quote here for one of the recent publications saying that even though the diseases are rare disease patients are many. It is therefore not unusual to have a rare disease. Now there's increasingly recognised national bodies. In Australia there's Rare Voices Australia. There's a national organisation for rare diseases in the United States, and probably Europe's doing the best in this at this stage with their European organisation, and also an organisation called OrphanNet. And one of the challenges is many of these rare diseases do present in childhood, and so they have an increased representation in the paediatric population, and they represent a significant challenge in vision impairment. Now there's a complicated table on the chart here, but what I've tried to do with this is looking at the top 500 selected rare disorders. 40 of those are actually eye-related, and it sort of puts it in perspective of where we are. So those uveitis is probably the most common of the rare disorders. Then retinitis pigmentosa, there's some of the other retinal disorders like Stargardt disease, anophthalmia, microphthalmia, interesting that that's comes in just ahead of cystic fibrosis. So you can sort of start to see the significance of all the eye conditions there. I mean, I think this will be available later on the website and in the handouts that Renee will provide. So that would be useful to get a perspective of where the conditions that you may have fits into the scheme of things. But the message is that there's a significant number of eye conditions in these top 500 rare disorders, and it's just trying to get the perspective that it is an important area and what's partly driving the research. Childhood eye conditions can be grouped into treatable and preventable, or the currently untreatable. And so obviously it's important that we can identify the treatable and preventable, and Australia's quite lucky in that it has a very good screening program, and at present there's 2 time points. There's all children are screened at the 6-week check after they're born, so that's by often the neonatal nurses and the early childhood screening centres. And then each state then has a screening program around the commencement of school. And the New South Wales program is called STEPS, and it's probably the best program in the country, and it offers screening to every 4-year-old. So once you turn 4 years of age, then the program will reach out to you and offer free screening. And this is done through the childcare centres or the early childhood community centres. And in New South Wales, there's 90,000 4-year-olds, and at present about 70,000 take that up every year. So that we could do better, but it's still identifying people with vision impairment. The other point is to where we come in treating eye diseases. And we've all heard about diabetes and macular degeneration, which tends to affect older people. And one of the interesting things that's occurred because of advances in treating these conditions is that for the first time in about 50 years, diabetic retinopathy is not the leading cause of vision impairment in working age people. It's been overtaken by inherited retinal disorders. And so that sort of highlights 2 things. It highlights, one, the advances that have occurred in treating diabetic eye disease, because there's many more people now with diabetes, so the problem's getting larger, yet they're getting treatments, and part of those treatments were pioneered at Sayside Institute by Professor Mark Gillies and his team. But those treatments now are stopping people losing their vision. But we have the other group of people with inherited eye disease and genetic work, and that's where Robin Jamison's work is really starting to lead to look for treatments for this sort of group. And that's, I think, where a lot of our energy is focused in trying to find treatments. And in some ways where we are is sort of diabetes 30 years ago was starting to do clinical trials. We're only in the start of the journey of really trying to get treatments now for these inherited eye diseases. But there's been enormous progress made in the last 5 years. Perhaps the last part of this talk is looking at the changing care paradigms, and we've had sort of what would be considered perhaps parallel streams to some degree with limited overlap between the medical system, vision support services and education. But really it has emerged, and that really it's a much more interconnected service that we need to deliver. And I think that's partly prompted days like today, where we've brought together all of us, those who are affected by vision impairment, those who provide vision support, and to exchange ideas. And it's these family days that have certainly stimulated us at the Sayside Institute to try and look at better ways of trying to deliver health care. And one of those has been the funding of a position called a patient care coordinator, because one of the challenges is that you might visit the doctor and be given this diagnosis of vision impairment, and which is obviously a very devastating diagnosis. And we now have somebody who can help link people up with the services and to help go through that and provide a connection back to the treating eye doctors to help sort of bridge this gap at this very challenging time. The family days bring everybody together, and so we appreciate your time here today. The other thing that I think that Robin was alluding to before, as we're starting to develop treatments, we sort of need to understand in greater detail what actually happens with the eye conditions themselves, and so that when interventions occur, we know what to expect. We don't want to make the condition worse for a start, but we need to know, well, why does one person suddenly the vision goes quickly, others goes more slowly? We need to be able to sort of map that. And we've had a great advance in the technology of assessing vision in both sort of structural changes and functional changes. And so it is worthwhile continuing to have that relationship with your eye doctor so that these more modern investigations can be done, so that we can map where you are on the continuum of the condition, so that as the treatments become available, then we'll be able to sort of see whether, one, you're suitable for it, see what impacts it might have, and see how the treatments, if they're implemented, may benefit people and not make it worse. So I think there is an important connection with the new assessment methods to try and work to stage the condition to work out where our therapies are going to go.